This is Eskimo TV with our guest today, Dr. Michael Wolf, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Pisco, PC. Today we're going to be speaking about multiple sclerosis. Doctor, what is multiple sclerosis? How is it caused?
Well, multiple sclerosis is an autoimmune, neurologic, and neuromuscular disease. Now, the cause of multiple sclerosis, or MS, is not really known, but what's suspected is that there's a genetic underpinning that increases a person's susceptibility to various environmental factors triggering MS in a person, which is an autoimmune disease. So some of those environmental factors might be poor diet, such as high intake of milk products in adolescence, increasing the risk of MS, low vitamin D levels, increasing the risk of MS, saturated fat intake, but also certain infections such as Epstein-Barr virus, also known as the kissing disease or mononucleosis virus, or various bacteria such as Mycobacterium pneumoniae. There are literally dozens of different types of infections that can trigger MS, and then there are dietary factors which seem to at least exacerbate it. So, in a nutshell, what multiple sclerosis is an autoimmune disease where, because of one or more triggers that a person is susceptible to, the immune system breaks down in certain characteristic ways. For example, in the brain of those with MS, not everyone, but most people will have what's called plaque formation, which are areas of basically killed off brain matter, which is the surrounding portion of the brain and various nerve cells known as myelin. So they have myelin degeneration. And depending on where this degeneration is in the brain, a person will have various symptoms of MS.
And what treatments are available for this autoimmune disease? Are there any natural therapies?
There are many natural therapies for MS, and my book will be outlining them. But in a nutshell, diet is a huge factor. Long-term studies in those with MS show that when they adapt a very, very low-fat, healthful diet, which means one that consists of low-processed foods, high intake of vegetables and fruits, and high in omega-3 fatty acids, for example, the disease progresses much more slowly over time. There are lots of different specific supplements, various vitamins, minerals, and herbs that may also help. All of them that should be figured out from laboratory work, but just to name a few of them would be a high intake of omega-3 fatty acids either from fish or non-fish sources, which help reduce inflammation in the brain and spinal cord, which is what's affected in those with MS. And then there's also ginkgo biloba, for example, which improves blood flow to the brain, active folic acid, which helps the brain and spinal cord rebuild myelin, along with vitamin B12 and B6. So there are many, many different examples of nutrition and MS. So many, in fact, that it's very important, again, as I said, for the individual to find out what they need. And that's based on testing and also based on research.
And how can vitamin B12 and folic acid be helpful to someone with this disease?
And there's been a lot of study on the use of folic acid and B12. And the first thing I should say is that they should be used together and never alone. That doesn't mean together at the same time necessarily when you're taking your supplements, but at least in the course of the same day. Both of those nutrients are important for a process of healing in the body known as methylation. But it's also important that a person take the right type and amount of folic acid and B12. The right form of both of those nutrients are known as methylated forms. So there's methylated B12 and there's methylated folic acid. Both of those nutrients help to maintain the integrity of the brain and spinal cord, helping to repair myelin. And also for a variety of unknown reasons, these nutrients have shown to slow the progression of multiple sclerosis down. That means slow the course of the disease down. Now, these supplements are associated with a certain amount of slowing down the course of the disease, but there are many other types of nutrients as well that add to the slowing down of the course of the disease.
And what role do vaccinations play in multiple sclerosis?
Well, that's a very controversial area, the role of vaccinations and inoculations in multiple sclerosis. But there are studies that show that certain types of vaccinations might actually precipitate or cause a variety of autoimmune diseases in people, not only multiple sclerosis. The studies are very inconsistent, so I would say this much. There are individuals that are genetically susceptible probably to vaccinations triggering autoimmune diseases. There could be viruses and other foreign substances or irritating substances in inoculations that a person that is genetically susceptible to MS might not do well with, such that, for example, the measles vaccine, there's been some research showing that the measles vaccine can trigger demyelination in the brain. Demyelination is the process of brain degeneration that takes place in multiple sclerosis. However, most of the research is inconsistent. But there's research and then there's how individuals might respond to things. So it's, again, a very controversial area, but certainly I would say that if someone has not been vaccinated yet and they have multiple sclerosis, they might want to look and see what's in those vaccinations to make sure that their immune systems would not be triggered and causing an exacerbation of their multiple sclerosis once they have it.
This has been Eskimo TV with our guest today, Dr. Michael Wolf, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine, now Case Thank you.